most famous physical therapist on the internet.
Hi, folks. I'm Bob Short, physical therapist.
Brad Heineck, physical
Together,
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob. Humble opinion.
That's
of course.
right. Today, we're going to tell you how to use a massage gun for trigger finger. Now, Brad has had trigger finger, and you still suffer from it from a little bit, but it's much improved.
Yeah, I wouldn't say suffer. It's there.
Okay,
It doesn't
it's
bother
there.
me. Suffer word bothers me sometimes.
And you've done some of these things that we're
Oh,
going to mention
yes,
today.
yes.
So,
But, yep, it's still there, but it's not too bad today.
well, one thing we want to show you, look at all these muscles on the front of the forearm. They go down, and a lot of those muscles go into the hand. These are the tendons from these muscles. And
It's working good.
yeah, when the tendon gets up into this spot right here, some of them go through a sheath.
Yep,
It's like a tunnel,
right.
a ligamentous tunnel. And if there's inflammation here, as you can see, this looks like it's inflamed. It won't fit through that sheath as well.
They actually, technically, they call it a pulley.
Yeah, they do call it a pulley
Yep.
system. Yeah.
So the tendon goes through a pulley, and we're going to demonstrate that using a pulley. But,
Right.
yeah, did you want to?
No, I think, Brad, why don't you show that now? I
Yes.
think that works really
So
good.
with trigger finger, like this is my trigger finger, my third one. And sometimes it'll go, and you can feel it go through that pulley, and there's a bump in it, and it goes click, and it stays there.
Yeah.
And then if I push it or bring it up, it goes click. And if you have trigger finger, you know exactly what I'm talking about. I've worked with mine, and it's smoothing it out. But if I ignore it for a while, a few weeks, it starts to come back. So if you look at the tendon being this white rope, if you will, and here's that pulley. This is just a model. It's not exactly like this by any means, but you get a bump in the tendon. Well, right there. So there's the bump in the tendon, and it goes and it gets stuck. And then it pulls through. And there it is on this side. So what we need to do is work that so that we
Smooth that bump out.
exactly right. Oh, I'm stuck in there now, and that may happen.
Oh, it goes
There it goes. Oh, I see.
Yeah.
You probably don't have an eye hook in your
Yeah, that's right on.
in your body, but that's the concept.
But
And
that's
once-
what you did. You massaged that bump,
Yep,
and it got better.
yep.
Correct?
And you can do it manually. I do it manually. I use my thumb. I've used a massage gun.
And we're going to demonstrate that. Again, we're going to have to do the forearms
Yep.
and that bump.
Sure.
So, okay, as we showed the anatomy of this, and Brad showed the little demonstration with the pulley system, which I
Right.
thought was really ingenious, Brad,
and
that
the
you came
rope
up
and
with
the-
that.
Well, I might have got it from someone else.
Oh, okay.
No, actually, when actually the legitimate name is a pulley, it's like, well, I got pulleys out in the garage. We should make something work with this. So, anyways.
It's actually called, trigger finger is known as stenosing tenosynovitis.
Ooh.
Isn't that a mouthful?
I'd rather say trigger finger.
But anyway, yeah, there's inflammation. So what we're going to remember, we talked about massaging the muscles of the forearm to take a little bit less stress off the ligaments, going to that. So you can use a lot of different heads on that one. You could use the round head,
Yep.
like that,
The flat
the
head,
flat head,
the air cushion
yeah,
head.
air cushion if you want to start off a little bit less aggressive. Now, with all these, we always recommend, like our massagers come with 5 speeds. Start with the lowest speed.
Sure.
Because you don't know how you're going to tolerate this.
Yep.
You might get a little sore from this, and you can always bump up more the next day.
Yep.
So you're going to go ahead and work this, and you might even try a little bit of flexing and bending, flexing and straightening when you're doing this.
So we're doing a little flossing.
Yeah, a little floss
With
and
the,
see how it goes. But now, if it locks up when you do it, I wouldn't do that.
No. Yeah, it's especially if it's sore. I mean, sometimes it gets pretty tender. I know with mine, when it was bad, I didn't want to do that a lot. But then,
Yeah, why don't you show Brad what you did and what helped take yours away?
right. So this is mine right here. So I would massage here with my thumb, take my fingers on the back side and here, and I'd work it across. Okay, and I'd work it up and down, and then once I got in there and massage it, getting that knot, so to speak, to loosen up, then I would do range of motion with it, and I keep pressure on there.
The entire time.
Yep. and it was amazing. I thought for me it didn't take a lot of time to make it easier. You got to do it a few days in a row, but you know,
And it shouldn't make your pain worse.
no,
Really.
no, you'll feel it more than likely. You're going to feel it improve. If it's all flared up and really swollen for whatever reason, then if it is painful,
Then
and
you got to back off.
yeah, it doesn't improve after doing this for a minute or two, you got to give it a break. And you can work your range of motion. When it triggers, it goes clunk over that clunk. You could try to work it through there, but eventually you want to get that massage in there. And as mine improved and I could do this, well, my thumb would get tired and sore. So then it's like I don't want to have trigger finger
Right.
on both hands.
You get trigger finger on your thumb too.
So I was using actually both of these. I started out with the soft head.
That's an air-filled head.
Yep.
That's pretty. It's probably the least aggressive head.
Right. This would be a good sized gun to use on it. I don't have this one at home, and I use this one, and it works okay. You just have to be a little less aggressive. But this one's pretty darn strong. So, you know, and I would work it like this, and then I would do the range of motion. But the gun gets in the way when it gets straight in. So if you go sideways and you're working it, and actually,
And that's where this one works the best. Probably.
yeah, here you want to turn
Yeah.
that off. These have a 3-second delay, so you got to hold it for 3 seconds
Yeah.
before it goes. And I would work it in this way, crosswise, and then I could work that range of motion with it. You know, if
that
you don't
works
have
out
a
quite
massage gun, I would, because I did a lot of mine without the massage gun. The massage gun just takes the work away from the other hand. I would not buy a massage gun just for
this.
trigger finger.
Right.
Because, you know, unless you're going to use it on the rest of your body, which if you buy one, you will.
Right.
And you'll be happy with it for the most part. But this is how I would work it. And
Yeah, you could again, as Brad said, start with your thumb doing
Yeah.
it, and then if you feel like you have other issues, you may want to get a massage gun.
yeah. Now, it was triggering this morning a little bit. And now after working this, you know, it feels pretty much normal now. It's kind of
By
fun.
the way, I have Dupuytren's contracture. I don't know if you can see that.
Can you
It-
see that?
My finger used to be tightened up to this point. This was as straight as I could
Yep.
make it. But I actually, I would like to tell you that I used a massage gun on it, but I didn't. What happened, I was doing pull-ups and it released. It actually, the adhesions must
Yeah.
have broken apart.
People used to comment on you. What's wrong with your
Yeah,
fingers?
yeah,
So it's right there.
exactly.
But now it used to be about right to there. Yeah, so it's
Yeah.
so do pull-ups.
Yeah, do pull-ups. Well, and you can actually massage this too now.
Sure.
I mean, when it's not too far along, it works pretty good to
Yep.
actually massage that area. And I always I read in books where they recommended massaging. And like, you can't massage it enough with your hands. You know
Yeah.
what I mean? It's too
That's
too
a
difficult
pretty
to do. Yeah.
chronic, you know,
Yeah,
a lot of scar tissue
I would use
in
a
there.
massage gun on that.
Sure.
If you want to, and you know they have procedures to inject it now and stuff like that, but they could come back even after the injection.
Yeah.
So,
And you've had yours for
30 years, 40
ooh,
years.
Yeah.
Yeah.
So it just goes to show you.
You live with it.
But yours improved.
Yeah.
Took 30
It
years.
took 30 years.
A bunch of pull-ups.
Okay.
Carry on.
Thanks.